this is February's Facebook Live. We are here today and we're going to do a lip augmentation with filler with Rustle and Kiss on our patient model, Melissa.
Hi!
So we're going to do, we've completed the topical numbing, we wiped that off, and we're all prepped and ready to start. So, you ready? Feeling okay? Okay,
yeah.
Sounds good. So, I already kind of gave her some warnings, but typically we start in the upper lip and the medial area. There's going to be some pinches throughout. They should be tolerable. Breathe through it, deep breaths in through your nose, out through your mouth. You have a little stress ball if needed. Let me know if you need me to take any breaks.
Okay, sounds good.
Right. But I'll give you a little warning with a pinch and touch, okay?
Okay.
All right, so I'm going to have you keep your jaw relaxed. Okay. And you'll feel my touch here on your lip, okay?
Okay.
And you'll feel a little pressure here too, because I'm going to kind of just try and distract you a little bit. Okay, so a little pinch here on the top. 1, 2, 3, pinch. Tolerable?
Mm-hmm.
Good. One down.
Yay!
We're going to work lateral here a little bit, okay?
Okay.
This also has numbing medication in it, so as I inject it, should get more and more numb and more tolerable, okay?
Okay.
Another pinch. And pinch. Doing good?
Mm-hmm. So you're using Rustle and Kiss today. What are the benefits of that product versus something else maybe?
So this is specifically made for the lips and a nice young lip that's just looking for more volume and has already a pretty good definition. I like to use this product because it's still very natural and soft pinch here. That gives you that volume that you want. Just gonna do a little massage here, okay?
So what's the healing time on something like this? When will she see full results? Immediately or?
So with filler, that's the nice thing. You can see results almost immediately, but you have a little bit of rebound swelling initially, and then they're gonna swell for the first 3 days. Swelling usually peaks around 72 hours. You can have a little bit of bruising. The lips are very vascular, so they always bleed a little bit, but she is really not bleeding much, so I can typically tell if you're gonna have a bruise here or there. And we do put ice on before, and I'll have her ice after. Arnica, as we talked about earlier, is also a product that can help decrease bruising, bleeding, and swelling, and I typically tell filler patients to start taking that a couple of days beforehand, and then continue the day of treatment and a few days after. And there's a sublingual tablet you can take, and there's a cream that you can apply topically as well. So.
And do you recommend that after treatment, patients massage the lip area, ice it, anything like that?
No massage. I massage things and that should be good. And I don't want you you can really move the product, but I don't really want you messing with it after treatment, because too much massage can cause more swelling as well. So no massage. And what was the other thing you asked?
I think that was it.
Okay. We'll
Any
come back. We'll circle back.
post-treatment instructions?
Oh, post-treatment instructions. Icing. You can ice. We're gonna go to this other top.
Okay.
Cupid's bow here, okay? 20 minutes on, 20 off. Don't do more than 20 minutes at a time, because again, you can get some rebound swelling. Pinch.
And this will last her how long?
This should last her a good 6 months, especially with her history. She has a foundation of some things. Lips about 6 months. Some people get a little bit longer, just depends on your metabolism, but you can see we're getting just a fuller volume here. Her bottom lip has a pretty good volume, so usually with injections we do a little bit more volume on the top lip to balance things off.
Should she stay away from anything after her treatment? Exercise?
Oh yeah, don't exercise today. You'll just cause more swelling.
Okay.
And little pinch here, pinch. But you can go back to some light activities tomorrow. Just keep in mind that if you do increase your heart rate, you might swell a little bit more, but
Okay.
it's not contraindicated, so.
How do you feel, Melissa?
I feel good. This little stress ball is helpful.
Yes, always.
But it's not too painful.
Okay, working a little laterally here, pinch.
A lot of times people get confused with Botox
Mm-hmm.
to the lip versus filler.
Yes, so Botox or Dysport can also be used in the upper lip to help flip, it's called a lip flip. And it can give you about 1 millimeter or 2 more of show of the upper lip. Only certain people are really candidates for it though. You don't want to just do it on everyone that wants a little bit of volume because it's a small amount of volume, and really people that like purse their lips are good candidates for it. Kind of have like a natural, like tighter upper lip. People with smoker's lines, you can do some like micro tox or tox in the upper lip to help soften those lines as well. But it's not going to give you the augmentation that a filler would. So a filler is in a gel form. I put it into these smaller syringes and needles to help cause less trauma to the tissues, but Botox or Dysport is a liquid that's injected into the muscle and then relaxes the muscle, therefore softens fine lines and wrinkles, where filler is a gel and it purely just plumps or adds volume to the area of the tissue. Okay, a little pinch over here.
Okay.
Almost on the top. Okay, on the bottom here.
Okay.
Pinch here. Pinch. Pinch. Pinch in the middle. Keep breathing, you're doing great. And we talked about this before her treatment, but she had a little asymmetry, which all people do. But her right lower lip is sits a little bit lower and is a little bit fuller than her left. So we're gonna try and balance that a little bit, but it's just good to know where your baseline is so that you can adjust things as needed and try and get that correction. Turn to me a little bit. Good. Pinch.
So you said you put about a half a cc on the top. Are you gonna do about the same on the bottom or a little bit less?
I'm doing a little less right now. Her bottom, which most people's bottom lips are a little, baseline a little bit larger. Pretty happy with where we're getting to right here. And some people don't need a full syringe. She has a history of having some filler kind of recently, so she has kind of that foundation built, and you were saying how it can sometimes be a little bit of a journey to get there to the volume that you want, because you don't ever want to like overstretch the lips and just add 3 cc's at a time. So I think that we're gonna be able to achieve the volume that you wanted today by getting there. So I'm gonna let you see these.
Okay.
And I'm gonna see what you think.
Perfect.
And then we can go from there. I'll show you where I think we might add like a touch more on the top.
Okay. Oh yeah. Much better. I love it.
So we avoid a duck lip. No one likes a duck lip, right? We want a pouty, nice,
Yes.
volumized lip. So we try and keep a lot of the filler lateral to give you some height of the pink roll of the lip,
Okay.
and just balance the bottom and top lip.
Okay.
If we were gonna do a touch more, I might do like a touch more here and here, but not a lot.
Okay. Whatever you think.
Okay. All right.
Perfect. Thank you.
We'll just do a touch more on the top.
Okay.
And hopefully you're pretty numb at this point. So, okay, a little pinch here.
Okay.
Pinch. How was that pinch?
It wasn't too bad.
And a little pinch here. Pinch. I don't think you're really gonna bruise.
Really?
You can tell, yeah. I mean, you're gonna swell. Everyone swells. The lips
Yeah.
are like so sensitive, but I always tell people, especially with their first filler, when they get their lips, I'm like, do not freak out. Your lips are gonna be, they're gonna be big the first day or two, and
Yeah.
like you can be like, what did I do? But that's completely normal.
Yeah. I
And
remember
it'll go
thinking-
down by usually by day 4. It
Okay.
goes down, but. And yeah. So this is for you. Just keep this in your pocket. You can keep them hydrated, and remember, drink lots and lots of water.
Okay.
And we'll stitch you up then. Very kissable.
Still numb.
Yep.
Thank you.
Mm-hmm. Let's stitch you up.
Put the ball back.
Mm-hmm.
Oh yeah. I love it. Thank
Natural.
you. Yes.
And right now they look a little like tight.
Yeah.
And so that will go away and it'll look a little bit more natural, but the volume should still stay.
Perfect.
This it's gonna get bigger, as you know,
Yes.
and then it'll go back down.
Okay.
Okay.
Awesome. I love it.
You look great.
Thank you.
Perfect.
Thank you, Amanda.